Did you know by using dermal filler, you're able to prevent having sagginess of the skin? My name is Nurse Yalda and I'm from Rejuvenation Clinic.
My name is Joseph. I'm from FitLab, the fitness laboratory. I've been coming to Rejuvenation Clinic for about 3 years. My fitness journey with Nurse Yalda is just the beginning. I'm 41 years old. It's all about prevention for me. So that's what we're here for basically a non-surgical facelift.
So the filler I'm going to use is Juvederm Voluma. Juvederm Voluma is one of the thickest filler in the market. What we're going to do is we're going to mimic his bone structure. As we get older, we do lose some fat pad and we lose this beautiful contour. So if you guys look at the models, the reason they look beautiful and exotic and they look very sharp is because they have a very high definition and high cheekbone. So by using this beautiful filler, we're going to create a beautiful high cheekbone for my patient. Hollowness there. Look how much better this would look, you see? So I'm going to put a little bit filler there. And then what I'm going to also do is I'm going to give you a little bit more support here. Okay, perfect. Vámonos. All right, guys, so what I'm going to do is starting with providing some support around his lateral zygomatic bone. Basically giving him a little bit of a lift and take this heaviness from his laugh line. The reason this little bit of a cushion happens here is the fat pad that used to be here, it's hanging on the lower part of his face. So we're just gonna start with a little bit of an injection. And tell me, Yusuf, how does this feel at the moment? Talk to us about the pain or discomfort.
No, there's no discomfort. There's no pain. I've been doing this for a good while. I think maybe limitless syringes. I think so. There's maybe on a pain level of 1 to 10, maybe it's a 2 of that. I think that's what scares people. It's like the pain level, where it's very
not painful. Guys, keep in mind the goal is, especially living in a DMV area, it's more like a conservative area. We would like to look healthy, fresh. I always use the emoji as an example. If you look at the sad emoji, everything is downward. But when you look at the happy emoji, everything is lifted. So the goal is to create more like a V shape, more like a higher arch, I would say.
Yeah.
All right. So we're working our way from top to bottom. Keep in mind, aging stuff from top to bottom. We're trying to push all the fat pad, all the ligament backward. So go ahead, turn this way. Gonna put a little pinch. And actually, I'm not using any numbing cream for the patient. The medicine has some lidocaine. So as I'm injecting, just providing some numbing. Patient is comfortable. And as far as the post-op care, my only recommendation is perhaps for the next few days, no exercising, heavy lifting, or perhaps for the first 24 hours, you do not want to apply any makeup. Alrighty. So if we bring the camera closer, go ahead, take a look at this side versus the other side. This side of the face is more lifted, more contoured, and as you can see, there's a more like a higher projection this side. like more like concentration, more like
a
the, yeah, a V. Like if you look at the models, the reason they look good, they have bone structure.
Amen.
So versus like just saggy tissue hanging on top of each other, we want to create like definition. And that's why, like, especially women, when they do their makeup, what they're doing, they're contouring and chiseling the face. And that's what sculpting is. All right, guys, so we're done with this procedure. We did 1 syringe of Juvederm Voluma. As I said, the goal is to prevent skin from becoming saggy. So as you guys can see, the patient looks amazing. There's no bruising, no inflammation. How was your procedure?
Very good.
Amazing.
Yeah.
So if you're interested, please feel free to call our office. You can also subscribe below, and I hope to see you at Rejuvenation Clinic. Stay tuned.